Hi friends, let's have a short discussion on this case scenario where there is a young female who complains of pain in the right upper abdomen after heavy meals. To investigate the cause of this pain, she underwent some blood investigation and some radiological investigation. The results are as follows. So when we see the result of this blood investigation, what we find is her CBC is perfectly normal, and in the liver function test, what we notice is that her alkaline phosphatase and gamma GT is on higher side, while her AST-ALT, also known as SGOT and SGPT, is normal. On the radiological investigation, she was diagnosed to be having cholelithiasis with multiple small gallstones, while at the same time the radiologist also reports that her CBD is dilated but no CBD stone found. So how we are going to further investigate or manage this patient? So friends, what we are dealing with is a patient who is having a symptomatic cholelithiasis because she is having pain. So she needs to take care of this cholelithiasis. So what is the treatment of cholelithiasis? The treatment of cholelithiasis is laparoscopic cholecystectomy. But here in this patient, what we are finding is two things. One, the dilated CBD, and the other thing, alkaline phosphatase and gamma GT is high. Do we need to really be concerned about these reports, or can we directly go for laparoscopic cholecystectomy? In this case scenario, what we are finding, CBD dilated. In a patient of cholelithiasis, especially having multiple small stones, if you find CBD to be dilated and alkaline phosphatase and gamma GT to be high, we should always rule out CBD stone, because there are very high chances that one of the stones may have migrated from the gallbladder to the common bile duct. But as the radiologist has reported, no CBD stone found. So can we just rely on this report? The answer is no. The reason being, sometimes we miss the CBD stone. The reasons are: one, there can be excess amount of gases in the abdomen. The second, the ultrasound is a very much operator dependent procedure. The third, the quality of the ultrasound machine also matters. So still there is a chance that there may be a hidden CBD stone which could not be reported on ultrasound. So how to rule out a CBD stone? To rule out a CBD stone, what we need to do is either go for an MRCP or ERCP, that is known as endoscopic retrograde cholangiopancreatogram. MRCP is just an MRI and it's just an investigative procedure, and it's not a therapeutic procedure, while ERCP is investigative as well as therapeutic. So if we come to know about a CBD stone on ERCP, at the same time we can remove the CBD stone. So in that sense, ERCP is better than MRCP in diagnosing, and as well as it can remove the CBD stone. And even if we do an MRCP, on MRCP, if you diagnose somebody to be having CBD stone, then we have to go for ERCP again to remove this CBD stone. And then the patient may be taken up for cholelithiasis, that is laparoscopic cholecystectomy. But the question arises, why we are so much concerned about a CBD stone? Even if we don't investigate this patient and we directly go for laparoscopic cholecystectomy, what can be the problem? The problem here is that if we have a CBD stone, and if we remove the gallbladder, that is by laparoscopic cholecystectomy, because of the CBD stone, there are chances that because of this back pressure in the common bile duct, which will go into the cystic duct also, so there are chances that after you have done with the laparoscopic cholecystectomy, the cystic duct stump may blow up because of this back pressure. And if it blows up, it can give rise to a dangerous complication known as either collection of the bile in the peritoneal cavity, or you can say the patient can have biliary peritonitis, which can have a high mortality rate. So to avoid such circumstances, in a patient having cholelithiasis with a dilated CBD, we need to rule out CBD stone first before going for laparoscopic cholecystectomy. And in a patient known to have cholelithiasis as well as CBD stone, we should remove CBD stone first, and laparoscopic cholecystectomy should be done after the removal of the CBD stone. Thank you.